If you have nervy pain going into your shoulder and down the arm, and you have already tried to work with multiple doctors with little to no results, then pay attention because I'm going to show you a different method for treating these kinds of problems that you can do at home in as little as 9 minutes a day. Adam here from TrainMassage.com. Now, I'm sure you're wondering what that one method is for treating your nervy pain. And the answer is to self-massage the muscles that's compressing on the nerves in the first place, which I'll get to later on. But to help you understand this, let me take you through a thought exercise that also helped me understand this as well. If you're watching this, then chances are you already tried to go through something like physical therapy. Well, I want you to think back to those physical therapy sessions and pick out 2 to 3 stretches or exercises. Chances are most of you had to end up strengthening muscles in the upper back, in the shoulders, and maybe even in the core, while also stretching muscles in the neck and maybe even the chest. And before we move on, I want to be clear, I'm not dismissing these exercises. I actually do agree with them. I just want you to think about why you're given this specific exercise in the first place and what it's supposed to be doing to relieve your nervy pain. And as you're thinking about that, let me give you some quick muscle facts that's going to help you come up with an answer. When a muscle wants to contract, it does this by shortening and pulling the bones it's attached to closer together. But when a muscle wants to relax, it will lengthen, allowing the bones to move farther away. On top of that, all muscles have an equal and opposite muscle that works against it, which means as one muscle contracts, the other muscle has to relax in order to allow that movement. So with that in mind, think back to that question and ask yourself, what are those exercises doing to help with the compression on the nerves? The goal of those exercises is to help strengthen and shorten the weaker muscles, which allows the bones it's attached to move closer together. And since all muscles have an equal and opposite muscle, when this muscle shortens, there's another muscle that has to be lengthening as well. Now, if your physical therapist is right, then that muscle that's lengthening is also the same muscle that's compressing on the nerves. And by it lengthening, it's also going to be decompressing on the nerves, which results in your pain going away. Now, does all that make sense? Now, of course, you're watching this because you already tried physical therapy and didn't get any results. And here's my guess to why. It's because even though your physical therapist is most likely right about this specific situation, it's also because they're probably ignoring those other muscles that's creating the compression in the first place. Or if your compression is for something like the first rib, well, again, from basic anatomy, we know muscles pull on bone, and there are muscles that attach specifically to that first rib and can help control it. And this is why the answer is to self-massage these shortened and tightened muscles, creating the compression in the first place, rather than trying to strengthen the weaker muscles that oppose it, which will then hopefully lengthen out that tighter muscle, which will then decompress your nerves. Did that make any sense? Now, of course, you can also ask, well, why can't I just stretch out those shortened muscles? And that is a valid solution if you have the patience for it. But the reason why your self-massage is so dominant in this specific situation is because of the fascia system that intertwines with the muscle itself. To keep it simple, think of your fascia system as this one giant rubber band that connects the entire body from your head to your toes. And it's this fascia system that can not only create tension over time, which results in compression, but it can also lock those muscles up in either a short position or an elongated position, preventing them from getting stronger or stretched out. And this is why you need to start with self-massage, so you can first loosen the fascia system around the muscles before you attempt to train them or even stretch them. So of course, if you're a believer in this and you want to get a quick win, then I highly recommend working on these 3 muscles first. Now, the first muscle you're going to want to work on is going to be the scalenes, which can get tight and compress on those nerves from things like forward head posture. You can start releasing this muscle by performing static pressure. Find the most tender spot within the muscle and just simply hold on to that pressure area for roughly 2 to 4 minutes or until you feel a change. Make sure you're able to breathe throughout the entire time as well. And besides this basic static pressure, you can also perform something called micro movements, where you're pinning down that tender spot, but then you're moving back and forth and side to side on it in order to help release it and increase that blood flow a little bit. And then finally, you can also perform a pin and stretch by tilting your head to the same side that you're working on, pin the muscle down, and then stretch it by laterally tilting your head to the other side, trying to touch your ear to your shoulder. And of course, if you want to stretch this muscle out, all you have to do is tilt your head to your shoulder where your ear is basically trying to touch it, and make sure your nose is nice and straight. This is going to help stretch out those scalenes on the opposite side. Now, before we move on, if that muscle or the fascia is tight, then chances are it's going to be tender, maybe even a little painful. And that is actually okay here as long as we're able to breathe through it. Because if you're able to breathe, then the muscle's able to relax. Think about that for a second. If you're trying to hold pressure somewhere and it's tender and you're tensing, well, that tensing is contracting the muscle, something we don't want to be doing here. So again, you can hold pressure. It's okay for it to be tender as long as you're able to breathe through it. On top of that, all these muscles we're working on will be near some nerves and blood vessels. So we do run the risk of pressing on them. And if you do, then don't panic, because it's okay. All you have to do is simply move over a little bit to the left, right, up, down, wherever you are in order to change the area, and then try again. Trust me when I say this, nerve pain and muscle tightness or tenderness is two completely different kinds of pain. And just to give you some kind of perspective, if you've ever hit your funny bone in your elbow, well, you're not hitting a bone, you're hitting a nerve. That right there is an idea of what nerve pain feels like. So with all that said, let's move on to the next muscle, which is the subclavius. Now, if you remember earlier how I talked about certain muscles attaching to that first rib, well, this is one of those muscles. This muscle attaches not only to that first rib, but also the clavicle in the front of the body, which, if it gets tight, can actually create compression by either pulling the first rib up into the clavicle or pulling the clavicle down into the first rib. And guess what's between all those bony areas? Your nerves and blood vessels. And just like having bad posture can create tightness in the scalene, it can also create tightness in the subclavius, along with chest breathing versus stomach breathing. Now, in order to release this muscle, start off by getting your arm and placing it on top of an elevated surface, which will help pull the clavicle away from the first rib and allow you to access the subclavius. From here, start off by performing some static pressure on the most tender spots. You can then move into some micro movements by moving back and forth and side to side, or you can do a pin and stretch by shrugging up and down and even rolling your shoulder back and forth, which will help move that clavicle around. Now, this muscle is hard to stretch out, but that doesn't mean we can't help release that first rib. And one of the first techniques I love to do here is going to be using a lacrosse ball and a giant monster band. What you want to do is take a lacrosse ball or even something like a golf ball and place it on top of your shoulder between your clavicle and your scapula, right there in front of the giant trap, basically. And what you want to do from here is simply take that monster band and place it over so it's applying pressure down into the body as you step on the other side of the band. From here, you're just going to allow it to apply some pressure straight down in order to push that first rib down, which will help decompress that area. On top of that, you can also move your head to the side, look away, and pull it away in order to help open up that gap a little more. Now, if you don't have those kind of tools, then you can also just take a simple broomstick, throw it into a corner, and then push the top area, same exact area, into the edge of the broomstick as you're laying down, and then apply pressure into it. Again, we're doing the similar things here. You can then take your arm and move it through its full ranges of motion, or as much as you can, or you can take your head and twist it back and forth and side to side, well, tilt it, in order to help open up that gap and push that first rib down. Now, the third muscle that is common for creating compression on your nerves and blood vessels is going to be the pec minor. And just like every other muscle, this one can also get tight from things like bad posture and just simply being overused, which is very common for all the muscles in the front of the body versus the back, if you haven't picked up that pattern yet. To start releasing the pec minor, use a foam roller, massage gun, whatever you want, and begin hitting the most tender area for roughly 1 to 2 minutes. From here, you can then perform some micro movements by moving back and forth and side to side on that tender area, or you can perform a pin and stretch by moving that arm through its full ranges of motion as you pin down that one spot. On top of that, you can also stretch out your pec minor by placing your elbow against your side and placing your hand up against the wall, which will then allow you to pivot and rotate and get a good stretch in that pec minor. You can also use a corner of the house if that's going to be easier on your wrist. Now, if you worked on each muscle for roughly 3 minutes each day, then you should be able to relieve your nervy pain in no time at all. But for whatever reason you don't see any results, then you may need just a little more work, which you can find by watching the video in the top right corner. I'll see you over there.